Hi, good afternoon, everyone. It's Graham Raper speaking here. I'm the General Manager for R&G Health and Safety Coaching. We're just going to run through today on the changing of the culture and persons of influence. They kind of tie in together and it's related to the Health and Safety at Work Act. Throughout this presentation, feel free to, in the chat box, to pop any questions in there that you wish. What we will do is we'll collate all the questions and some answers to those, and we'll send them out following the webinar. Just a very brief background on ourselves. I've been involved with health and safety related processes since 2003, since the introduction of the New Health and Safety Act, which we've focused on ensuring that the intent of that is, we've had over 1 million hours of zero lost time injury, which we're really pleased about amongst our clients, which are even more pleased than 40 odd years of experience amongst us all. So what we're going to talk about today is why we need to change the culture. Hazards versus risks, persons of influence, and how to make this change so it's effective for all. And what we mean by effective, and what I mean by effective is ultimately we don't want people harmed in the workplace. I think that just goes without saying. We all want that. But also, if you follow some simple processes, doing health and safety effectively should add value to your business and actually shouldn't cost you money. So you've probably heard this all before. New Zealand has one of the highest levels of work-related harm, particularly by international standards. And out of that, and out of the report and those, staff must take ownership and have an accurate approach to health and safety in order to achieve zero harm. Zero harm as a notion has been mentioned on a number of occasions, and it doesn't seem realistic. I'm not quite sure what else would be a target. And I've had many decades working in the ambulance service as an advanced paramedic. And do we say, well, one death in an industry is okay, or one lost limb is okay? And I think we'd all agree that none of those is okay. So that's why we use the term zero harm. It's a goal to work towards, but accepting that nothing is acceptable. We just don't want people injured. We want people to go home unharmed at the end of the day. Hazards versus risks. This is a really important thing to understand. The old Health and Safety Act talked a lot about hazards, and a farm was full of hazards, a workshop was full of hazards. Everything was hazardous, but it didn't actually reflect the risk. So the staff came up with this particular saying, which I have to say it actually sounds much better than what I could come up with. That a hazard is a thing that could be dangerous. It's a thing that could be dangerous. We see those all the time, everywhere we go. A risk is a result of that thing being dangerous. The result of harm is created when humans interact with the thing. Now, it might seem a bizarre thing to think about, just a thing, but it doesn't matter how you apply that, it makes sense. If a piece of machinery is stationary and doesn't do anything, it's a thing that can cause harm, it's a hazard. But if it sits there idle, doing nothing, nobody goes near it, it's a nothing. It's only when we start to interact with whatever it is that we're doing, whether it be a piece of machinery or a hole in the ground or whatever it might be. So it's really important. The new Health and Safety at Work Act reflects on risk and managing risk. So it changes a shift from recording and monitoring of all these hazards to managing risks. Now, the health and safety, the reason for that is, and people often ask the question, why, because this all was driven out of Pike River, of course, why was nobody prosecuted at Pike River? Well, the reality is the paperwork was good enough. But what was very apparent is the paperwork did not manage the practice. In volume 2 of the inquiry into the Commission of Inquiry into Pike River, there's evidence there that the miners were covering up methane sensors and blowing fresh air, and not. But so they would record the methane sensor when it was covered. So by the time the report got through to the people who made other decisions, there was no need, I think, to do anything because the levels were high. The effective levels of methane in the coal mine, and I may be corrected, but I believe it was 0.68% of methane in a mine. It seemed to be when it's getting up there. The inquiry talks about people mining in 2% and as high as 5% methane levels. This is why the Act needed to change. It needed to change to ensure that everybody took responsibility and didn't say it was somebody else's responsibility, to reduce the impact of people not doing what they should be doing. Just an example of hazard and risk, a person on a quad bike and a rock. And that is supposed to be a rock. Yeah, about a few people laughing here. I didn't draw the rock, by the way. And the quad bike without a rider on. But what we're really trying to say there is if we had a quad bike stationary in a paddock and a rock, they're a risk. There's a risk of running into the rock as there is a risk of running into the quad bike. The only thing that changes from the hazard thing is, and the risk point of view, is when we put a rider on to the quad bike. Now we create the risk. So the rider is ultimately responsible for operating that piece of machinery safely. Now there's sort of a rock in the paddock. If they choose to ride into that rock and ignore it, it'll hurt. If they got off their quad bike and ran headlong into the stationary quad bike, it would hurt. If they ran headlong into the rock in the paddock, it would hurt. The point we're trying to make here is that quad bikes aren't hazardous, rocks aren't hazardous, so many things that we do aren't hazardous. What happens is we interact with them and we create the risk. And the facts are very clear. If you operate a quad bike effectively as per the safe operating procedures, it will not hurt you. If you use any machinery appropriately and according to the safe operating procedures, it will not hurt you. What changes is the human interaction. The other part that has been put into the Act in the section is called recognises a person of influence or persons of influence. Now this has been put in the Act, and the best way I could describe it is way to stop passing the buck. So we'll take Pike River. The miners thought it was somebody else's responsibility, to the mine inspectorate maybe. But the mine inspectorate may have said it's middle management said it was senior management, and so it goes on. But what was absolutely clear, and it is absolutely clear today, in any of the interaction we have in the workplace, that everybody is a person of influence. Some people have more influence than others, but the fact is everybody is a person of influence. If in your day-to-day the duties, you do something that could harm others, then you, as a person of influence, need to manage that. And it doesn't matter what level of the organisation that you're in. If there is an incident, everybody that's involved in that incident will need to provide evidence that they took all reasonably practical steps to prevent harm. When we talk about all reasonably practical steps, If you're never sure what that actually means, when you're evaluating a risk, ask yourself, would it be reasonable to do X, Y, and Z to prevent being harmed? So if you're jacking up a car, you might ask yourself, is it reasonable to put a safety stand underneath it? If you're climbing a ladder and you're going to be up there for a long period of time, would it be a reasonable thing to do to put some measures in place to ensure that you didn't fall? Is it reasonable that you're using a step ladder to change a light bulb? Do you need a whole safety plan and all the rest of it? Of course you don't. It would be unreasonable to do that. You're stepping up, but the risk is insignificant. So it's about applying is it reasonable that I should do this process in your risk analysis? So the hard bit, well, it's actually not that hard, and not so, it's how to make this change. The first thing is that everybody understands they're responsible for the risk. And as an owner of a business, a PCBU, you need to demonstrate safe behaviour, or the behaviour that you have an expectation of staff. There's nothing worse than an organisation that operates on the do as I say, not do as I do premise. We know that people who view that take any, would it be in this particular case, safety initiatives as being a nonsense. So unless you're prepared to walk the walk, so to speak, then a shift in culture will never change. You'll never build the trust and respect of staff, and the changing of those behaviour patterns need to be communicated clearly and, importantly, involve everyone. A recent role that I undertook for a large organisation decided that they were having a lot of problems on culture change, or changing how people interacted with health and safety. So it's a multinational company. Now, on the health and safety leading committee, they had managers from all over the country would attend. They didn't have any people who were on the ground floor, on the shop floor, so to speak, as part of that process. So when the board met and they met with this health and safety team, all they got was a manager's opinion. It wasn't until we worked with them and started to rotate, we had a rotation of staff from different sectors coming and talking to the board themselves, that they understood that the health and safety program and what they had in place was so document heavy, so process heavy, that nobody actually did anything anyway, because they didn't have the time to do it. So we made a very quick change on making it easier for people to provide feedback on any safety initiative, any near misses, and so on. Those people were reporting directly to the board as well. As a result of that, that organisation saved themselves, a multinational, about $10,000 a day. They all knew the problem, but they didn't know how to fix it. When they came up with a very simple solution that staff could come up with, it was about $10,000 a day that they were saving throughout the country. Not insignificant. We also, learning from experience, those of you who've wandered around and seen mechanics workshop with change across the door, for example, it's another very good example. Anyway, so the reason for that is because all the hazards that are inside a workshop, a mechanical workshop. Well, if you're not in the workshop, there's no risk, is there? Just think about it. If you're not in the workshop, there is no risk. But then we put a chain up on across the doorway. Now, habit and culture tends to find that people will step over the chain to go in because that's their behaviour, and go and talk to the mechanics or whoever it is inside. We know in the last 12 months there's been injuries to ankles, shoulders and wrists of people tripping over the chain. I also know from my own experience as a paramedic that of 3 fatal incidents where people were run over by their car, either from the front or the rear, after they got out to move an obstacle. So let's do a really quick evaluation on this. The research that I've been able to find is that no person, other than a staff member, has been injured walking into a workshop. No members of the public, no representatives of other companies have been injured walking into a workshop. We know that mechanics are getting in and out of their vehicles regularly throughout the day, and then they're getting in and out of their vehicle to move, to open a chain to drive through. We've now created a risk, a known risk. So the purpose of the chain to prevent people walking into an area that doesn't show any evidence of harm kind of doesn't make sense. So what we do in a case like that is that we put up a big sign that says no entry, report to the office. Engage with the staff to say, it doesn't matter who it is, they do not come into the workshop. Within a matter of weeks, we've changed the behaviour and the culture. Nobody now walks into that workshop, or workshops we've been working with. They will go to reception where they can be supervised. We've seen an increase in productivity because the mechanics aren't being interrupted every 5 minutes or so from representatives and members of the public coming in and asking questions. We've also seen a massive reduction in the old the skinned knuckle brigade when you're doing something and you get distracted. The people who used to go in very quickly change their behaviour. They report to the office where they can be talked to the managers and so on who they went to see in the first place. So if we take health and safety seriously, it should add value to your business. And then when you think about it in more logical terms, based on risk, it should improve productivity as well as reducing incidents of harm. There's a statement there that culture defines how you are as a company. Now, it's kind of a broad statement, but a culture of any organisation does define everybody within that. Nobody wants to be known as a company that doesn't take care of its workers, doesn't take care of the members of the public, and pays lip service to issues around safety. If they're paying lip service around to safety, what else are they paying lip service to? But when you have a culture of an organisation that's focused on ensuring that quality work is done, and we have a quality policy in our program, people who do quality work tend to do safe work. People who do it at a bull at a gate type tend to take shortcuts. So when the culture is focused on producing the quality of work, we reduce the possibility of incidents taking place. But that is also noted by our customers and clients. Working in a culture where everybody's involved in the outcome enables ownership. These are probably not new to you, these kinds of statements, but rest assured, when you have those operating, it has more benefits than negatives in improving productivity. So following this presentation, you'll receive an email outlining sort of the next steps. Feel free to join us next week for another online session, which will talk about managing contractors or contractor management. But in between there, if you'd like any consultation or require further information, feel free to give us a call, any of the team here on the number there, or any questions you might want, just send them through to support@rghs. So once again, thank you for taking the time out of a very busy day, and hopefully you haven't interrupted your lunchtime too much. Hope you felt this useful. And again, feel free to make contact with us any time if you have any questions or anything that we can provide you guidance on. Thank you very much again.